We turn now to a startling milestone in the COVID pandemic. Global cases surpass 300 million as the Omicron variant continues to sweep across borders. And while Omicron's driving cases to unprecedented levels, experts do say there's hope because death rates with this variant have remained relatively low, unlike with the previously dominant Delta strain. But health officials are still urging everyone to get their booster shots. The CDC issued new recommendations saying the COVID vaccine series is not complete without that additional dose. The decision comes as data continues to suggest the initial vaccine doses are less effective against the Omicron variant. Let's now bring in our friend, someone you'll recognize, NBC News medical contributor, Dr. Kavita Patel, for more on all this. Dr. Patel, great to see you. Good morning. So I want to start right there with what I just said about vaccines, because I think some people might think, wait a minute, what did she just say? And what's the latest with dosing? And what makes me fully vaccinated? So let's just start there. What is this new guideline and what does it mean? Because there was this important distinction before between your first 2 doses of an mRNA vaccine, so Pfizer or Moderna. That second dose wasn't a booster. It was just part of your vaccine. Is that what's now happening with that 3rd dose? And then in a minute, we'll get to what's going on with J&J.
Yeah, that's really just to make it a little more simple, and it's hard with sometimes with some of this language. You're absolutely right. Those original doses, that's what kind of constitutes the definition, somewhat legal almost, of fully vaccinated. That's why you're hearing that term used a lot. But to really be up to date with your vaccines, which is really what we care about as people to prevent disease, you really do need that 3rd shot, that booster dose, as we're calling it. That's for the mRNA. For Johnson & Johnson, I know, Savannah, we've talked about this. It's a little different because 2 shots of Johnson & Johnson is still what you really need to be considered fully vaccinated, which leaves a lingering question for Johnson & Johnson recipients that I think everyone should ask. Do I need a 3rd shot of something? So far, the data is mixed, but I've even been recommending that patients ask to see if they need a 3rd shot, especially with Omicron.
You know what that sounds like to me, Dr. Patel? That sounds like a phone call between you and I a little bit later as a J&J recipient initially. So, okay, so then what does this mean, though, for people who are thinking, hey, I'm fully vaccinated, but maybe they haven't been boosted yet? So, for example, there are certain places with these vaccine mandates in place. Here in New York City, I can't go into a restaurant without showing a card that on mine had just had 1 dose of J&J and then has my booster on it. But, you know, that says you're fully vaccinated. Is fully vaccinated now 3 doses? Are you not going to go into a restaurant without having that, what was a booster, which is now just part of the vaccine?
No, and that's why I think it's important to kind of parse out that fully vaccinated for the purposes of cards, transport, travel, even international and domestic travel where you need it, is really still that original series. I really do think of it as more of a legal definition. Think of it in a similar way of kind of the bare minimum, but then to be, quote, up to date, especially with the most protection, that's what really includes those 3rd doses. And we've already got countries like Israel that are offering 4th doses. So this is not a question of these vaccines are not working. 1, 2, 3, 4, 5, 6, when will it end? This is really a question of what do we need to do to protect against disease? Omicron has really challenged all of that, but vaccines are still protecting against disease. These breakthrough infections, if you're boosted, these breakthrough infections look like a sore throat. If you've just had this original series, you look a little sicker. If you've been unvaccinated, you're likely going to end up in the hospital if you don't have the protection.
All right. Great information there. It's so confusing, I think, for a lot of people, especially as people just hear, OK, I need another shot. I need another shot. This is such good information to help people kind of understand why and exactly what's happening here. Dr. Patel, as always, thank you so much. Great to see you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.